On October 2nd, students at the University of Washington were offered meningitis vaccination shots at the Student Union building. This comes less than a month after a student at the University of Pennsylvania died from meningitis less than 1 day after being diagnosed. We spoke with the Director of Hall Health, Dr. David Dugdale, and asked him, what is meningitis?
When somebody gets an infection of the meninges, that's called meningitis.
The meninges is the coating that encapsulates the fluid around the brain. Meningitis is a bloodstream infection spread by direct contact with respiratory secretions such as coughing, sneezing, or kissing.
According to the Centers for Disease Control, of the 2,600 Americans who contract meningitis each year, 10 to 15% will die.
Of the several kinds of bacteria and viruses that can cause meningitis, meningococcal is considered the most common and deadly, according to Dr. Dugdale. However, this is not the only way to contract meningitis.
And so people think that if they get this vaccine, they'll never get meningitis. That's not true.
According to Dr. Dugdale, the progression from infection to showing symptoms of the disease can vary from person to person.
Many people get the bacteria into their nose where it colonizes.
But what's really happening is that somebody who has never been colonized goes and lives closely with a bunch of people, some of whom are colonized. That's when the transmission occurs. So you see it in military recruits too.
According to the CDC, college freshmen are 6 times more likely to contract meningitis. This is due to a change in lifestyle, including increase in drinking, exposure to smoking, disturbed sleep patterns, and living in close quarters.
Students receive the more common of the two vaccinations.
One is called Menomune, and the other is called Menactra. Menactra is the newer one of those. Menomune has been around longer. And Menactra is considered the vaccine of choice for almost all situations. It's a killed agent vaccine, and so it's considered very safe.
Of those who survive meningitis, 20% will be struck with long-term physical disabilities, including brain damage, hearing loss, strokes and seizures, limb amputation, and other long-term disabilities. There are 2 important things that freshmen need to remember. First, getting the meningococcal vaccination does not mean you'll be completely immune. There are several kinds of bacteria and viruses that can cause meningitis.
The second is if you experience any flu-like symptoms, it is recommended you see a physician immediately.
For more information, click on the links to the CDC and Hall Health websites on our blog.
I'm Matt Kirchner.
I'm Chris Heide.